All right, my name is Lexi Good,
And I'm Rachel Williams.
and today we're going to tell you a little bit more about HIV and AIDS and its effect worldwide. In 2019, there were approximately 38 million people currently living with HIV, and tens of millions of people who had died of AIDS related causes since the beginning of this epidemic. In 2010, the amount of people currently affected with HIV was around 30.7 million. And so in those 9 years, it jumped up about 7 or 8 million people. Now, that seems like a lot, but it's partially due to the fact that there are new treatments that are prolonging people's lives instead of cutting it short. HIV transmission is only possible if bodily fluids such as blood, semen, any of spit, anything like that, comes in contact with a mucous membrane, such as uh, the oral mucosa, like your mouth, the inside of your nose, or any of your genitals, or any sort of damaged tissue, so like a cut or something along those lines. Or are directly injected into the bloodstream from a needle or syringe. And typically that's if you use like dirty needles, like instead of using sterile ones. You should never use a used needle or a needle that hasn't come directly from a sterile packaging because that significantly increases your risk for HIV transmission. Uh, Another way that it can be transmitted is if the mother has HIV and she has a baby and then through exiting the vaginal canal or the birth canal comes in contact with some of the mucus and can get HIV that way. Um, Additionally, the proper use of condoms can be used to prevent any sort of sex-related um, HIV transmission or just STDs in general because it's that physical barrier instead of just using like birth control to prevent pregnancy. Another medication to use is PrEP. So that stands for pre-exposure prophylaxis. And this is a drug that you take every single day, whether you have sex or not, in order to prevent um, the occurrence of HIV. Um, if you happen to come in contact with HIV, there is a medication called PEP, which stands for post-exposure prophylaxis. And that is a basically plan B for HIV, where you have to take it within 72 hours and then you take it every day for 28 days. And you have to get a lot of blood work done to monitor your cell count in order to see if you do test positive for HIV and all of that stuff. It's very important that people who actively engage in multiple partners do get regular STD, like in full panel screening, in order to identify these things.
So we also see a lot of issues with retention of care. These disparities are caused by gender, age, exposure, incarceration history, the place of birth, and overall the cost, as well as sexual orientation, as well and gender identity. Prior to 2018, it was not required by the electronic health care record to record sexual orientation and gender identity within a patient's admission process. Hospitals who have implemented this change have seen a 300% increase in the amount of people reporting the so-called SOGI information. This information is quite important because we know our LGBTQ community has a higher rate of infection, and by screening this process of sexual orientation and gender identity, we understand our patients who are at a higher risk. So, our men having sex with men, we understand that they are more likely to receive. So, it would be more beneficial for them to receive this screening and therefore providing a potential for an earlier diagnosis. Uh, Throughout the nursing school process in particular, we only receive about 1.5 hours of culturally competent care focused on LGBT issues and treatment. So this is universal across the board that many providers report that they don't feel competent or comfortable treating LGBT patients. And their training in this shows that members of that community have reported multiple times that when they receive these microaggressions from their providers, they're less likely to return to a facility. While if they go to a facility that is known to provide this competent care and this understanding of LGBT issues, that they're more likely to continue to seek treatment and receive that care. Hospital administration, we know their focus is always the budget, and that is their golden rule. And like I said, a big disparity is the cost of receiving this treatment for HIV and AIDS. Uh, so it's really important to emphasize to hospitals that the patient outcome is a bigger priority than maintaining the budget. And as healthcare providers, we're legally obligated to provide care for a patient no matter the cost and their ability to pay. So this is just an important reminder to just let people know it doesn't matter if you can afford to receive this care, because you will receive this care as long as you actively seek it. One of the future goals I would like to implement is currently being used in Ethiopia. It's the UN program called 90-90-90, where 90% of people living with HIV are aware of their status. 90% of people who are living with HIV are on antiretroviral therapies, and 90% of the people who are diagnosed also know and understand their viral load. People who are compliant with their retroviral therapies should not be taking any complementary therapies, because this can cause multiple issues as GI upset, hepatotoxicity, as well as increasing the level of this antiretroviral within your system, increasing the risk of toxicity within the patient. And understanding your viral load is really important as well, to know how infectious you are per se. This way we understand like which patients are at higher risk for spreading HIV and AIDS due to unsafe practices. As well as we know that viral load is important to understand the progression of HIV into the AIDS process. People are living longer with HIV and AIDS due to this antiretroviral therapy, and it's only become more and more effective since the 1980s when the epidemic first started. My first goal and suggestion to implement this program would be into South Africa, where we see the highest rate of HIV and AIDS within that region.
Yeah. To kind of piggyback off of what Rachel said, a lot of prevention strategies and management of communicable diseases come from education. Diseases spread more whenever there is a lack of education. We see this now, and we have seen it the past couple of years with COVID, just because of a lack of education, and as simple of things as hand washing increases the spread of a virus. I also wanted to mention the fact that if you know somebody who is HIV positive, there is such a stigma around it. It's important to understand that you can't get it just through like a hug or a handshake. It has to be a swapping of bodily fluids. So you just interacting with somebody who is HIV positive should not affect the way that you treat them. One thing that is up and coming also, somebody just back in February actually got cured from HIV through stem cell transplant. There was the use of cord blood containing an HIV resistant gene variant called CCR5 delta 32. HIV normally uses the CCR5 co-receptor to help it infect immune cells, but the receptor's delta 32 variant effectively blocks the viral entry. And up to 3 months after the transplant, tests showed that the patient's blood cell population was almost entirely derived from the HIV-resistant cord blood cells, and post-transplant studies could no longer detect HIV by various sensitive assays.
It,
So the patient was eventually able to stop taking any of their antiretroviral medications.
it's also really important to note that this stem cell therapy is not exclusive to people with HIV and AIDS. This therapy is also being implemented in treating people with Parkinson's disease, cystic fibrosis, and sickle cell anemia, eventually curing these patients of their ailments. overall improving their quality of life and extending their lives. It all is in the testing phase. So it is relatively new and we don't have a ton of information on it. Therefore, because it's so new, the cost of it is a little bit higher, making it a little more difficult to attain in comparison to the antiretroviral therapies. But as we progress medically, I foresee that becoming much more affordable and a better option for people who are living with HIV.
Yeah. Thank you.